Good evening. I'm Dr. Joel David, founder of D5 Teeth. And this is Michelle, our head D5 technician, and she's actually had the procedure done. So I'm grateful that you're taking a little bit of time tonight. And so this is a time we've been spending for the last couple of years. And we're here just basically in an informal setting to answer questions about what people might have about the D5 procedure. You know, this D5 was designed for if you have a lot of missing teeth, you've got advanced periodontal disease, you've had your teeth crowned 2 or 3 times, and now you have more decay, and you're wanting a permanent solution. And you know, a lot of patients have told us they thought that there was no more hope. And so, what D5 is, we think, is the 30-year-old. It's the reinvention of the 30-year-old teeth in the day technique, which many centers still do, and it takes about 6 to 8 months to do. So, you know, I just want to speak a few words tonight.
Hi, how are you doing? My name is Michelle, and I am the lead restorative assistant with Dr. David.
Yes.
And on the D5. And I am fortunate that I have these beautiful teeth. Would you like me to give them a little bit about
just
me?
go over, you know, so Michelle will go over basically when we did Michelle's case. In most of our cases, the routine procedure took 7 days. And what we're excited to introduce in our Jacksonville office for 2023, we've really refined the manufacturing process. And so now in as little as 4 days for many patients, we can actually do what it took us 7 days to do for Michelle. So go over basically, you know, your experience.
So my experience was I've been a dental assistant for over 30 years. And unfortunately, I lost a lot of my back teeth due to acid reflux over the years. And I did have a few partials and things, but, you know, I just never liked wearing them. They're always uncomfortable. They're moving all the time. So actually, I went without even wearing my partials for many years. When I was given the opportunity with Dr. David to be able to have this done, it was just a game changer for me. So just to give you a little bit of me, my procedure was done on a Thursday, and I had 16 teeth removed, and I had my implants placed. The very next day, I had temporary teeth.
Yes.
In plastic, but they were beautiful. I was still able to smile. It was wonderful. And then waited for my whole week. And let me tell you, I actually was back at work on Monday, which to me was absolutely incredible. If you have this done, you definitely need a couple of down days, but within 4 to 5 days, you're back to normal, you know. And my full schedule with Dr. David is from 7 to about 6 o'clock at night.
We're moving a little slow. We were working hard today.
Yes, we were. And I had my teeth within 7 days, and my full zirconia teeth, the absolute ones. This truly has been a game changer for me. Just the mere fact that I can eat on both sides of my mouth now, because, you know, by the time we got to this point, I ate on one side of my mouth for so many years. So it was just really getting to get all the good things back that you've been missing over the years. And for me, I eat everything. There is no hesitation on anything that I eat. I eat ribs, I eat apples, whole apples, corn on the cob, nuts. It's just incredible that
Now that's after the healing period.
Yes.
So, you know, what this is based on is called immediate load. The procedure was actually, I think it came out in 1996. I actually did the original teeth in the day procedure on my mother. So what this is based on is, imagine you have an arch and you put a circle of implants around the arch. The implants look just like aggressive wood screws. There's been incredible changes in the quality of the implants over the years. So back in the day, this is the big change at D5 Teeth. And this is what people originally hated about the procedure. If you came in until about 1996, what would happen? We would have to make you, if you had a lot of teeth, we'd just have to make you a simple denture. And when you make a simple denture when the teeth are in the mouth, there's a lot of guesswork because you can't try the denture in to make sure the midline's right, the teeth aren't crooked. So we would take your teeth out, put the implants in, wait about 6 months for the implants to integrate or fuse to the bone, expose the implant, everything, and still to this day, many practices, it's all basically denture-based, and you would spend about 2 months fabricating the teeth. And so for about 8 months, and a lot of practices, including ours, you would be stuck wearing flopping dentures for about 8 months. In 1996, Nobel Biocare and a brilliant surgeon, Paolo Malo, they came up with a technique where that's, again, the immediate load. You redesign these implants where they had aggressive threads. So they had a lot of primary strength when they went in. And they found out if you splintered them together within 7 days before the bone cells started really trying to integrate, then with a softer food diet, you could hook to them the same day. The problem with that procedure, and there's thousands of offices that still offer that procedure, is that you're still making the temporary denture. And when there's a lot of teeth are in, there's a lot of guesswork because, again, you can't make sure the teeth aren't crooked, the midline's off, that you even like the teeth because you can't try it in. But the improvement is, if you look closely, after the implants are placed, we'll show you a slide, you put these temporary cylinders into the implant, and after typically we did thousands of arches, we in about 3 hours could convert the temporary dentures so it's screwed in. So a better improvement than wearing a flopping denture for 8 months, but it was still bulky, midlines were off, and it didn't improve the speed. So what D5 did, we're on our 9th year. This has allowed us to open multiple offices around the country where we've been able to do thousands of arches in an expedited manner. Many in 7 days, and now for many as little as 4 days in our Jacksonville office. Takes a couple more days in our nationwide offices because of the shipping. And so, again, we're here to answer any questions. And so I see one question. Anybody have radiation to the mouth? So we have done patients with radiation to the mouth. That we have to be real careful and work with your oncologist, Kelly. And so it depends on the number of rads you've received to the area. So a lot of times people will think, well, I've had cancer, but I had a lot of rads to the neck and it really never affected the mandible or the maxilla, and we have no problem doing that. We've done a few cases in conjunction with the oncologist. If we go over the rads, then you have to go in a hyperbaric chamber. And the reason for that is the radiation interrupts the blood supply to the bone. And if you place the implants or even take out an infected tooth without the hyperbaric chamber, then you're in danger that the bone can't heal, and then you can have a massive issue. So again, it would be in conjunction talking with your oncologist that determines that. So again, we're here to answer any questions. We're going to go to some slides, but then please, any kind of questions you have, let's show you. Let's go to this. Okay, I just want to start off on this. That we found there's some practices that are kind of deceptive about when you look at what they're saying they're doing, you would think that you're getting permanent teeth the same day or you're getting permanent teeth the next day. So to the American Dental Association, permanent, final, and definitive are the same thing. Permanent or final or definitive means the final restoration when you're all done. So at our practice, to give you an example, say if you pick Monday as your main day, we would do surgery, records. Our lab literally works all night. The next morning, we insert a custom, beautiful temporary, but it's an interim temporary set of teeth. So even though it's printed, we've spent hours doing it, it doesn't use a material that has FDA, what's called 510 approval. And so that's why we can't say those are permanent teeth, even though they screw in. So if you see centers claiming that they're giving you permanent teeth or final teeth or definitive teeth the same day, just be careful and ask, are you using a material that has 510 clearance by the FDA is permanent? Also, this is another important point. Permanent means the final restoration that it is inserted to the patient with the expectation this could last the patient's life. So if you came in and somebody is saying you're getting a permanent restoration or a final restoration the same day, but they're clear intent because they know this is not a quality restoration designed to last for a long period, and their real final restoration occurs in 4 or 5 months, then they're being deceptive because obviously that is not a final or permanent. So be careful. We see there's plenty of centers, and you would swear to God when you look at their marketing that somehow they're faster than D5, that, we see people that they're, on the day of surgery, they're waking up with final teeth. You can eat corn on the cob, and then they're talking about zirconia. It's impossible to do. It's just total deception. So our main restoration, if you look at this, is the All Zirconia Pro. It's a one-piece all zirconia bridge. This is the workhorse in the industry. So the protocol of what we do to get to this restoration now in as little as 4 days is, if I can get the slide, is this. So this is how we do it. You come in for records, and we want an incredible smile for you. So we're going to really take the time to design your smile. You're going to come in and we're going to go through smile charts, and we're going to go and show you different ways or the anatomy of teeth can look good to your face. Do you have a square face, square tapering face, oval face, male, female? We design it the same way we do a master level makeover with veneers. Now, that's how most people pick their smile. The second way we can pick the smile is to go and basically say if you come in, half your teeth are missing, but I can look at what your centrals and laterals look like, or you bring me a picture that's 20 years old and you want to recreate your old teeth. You'll be amazed because of the hours we spent designing this, we can give you back your old teeth if they were in great shape, if they had moved around, maybe with a lighter shade. So 2 distinct ways you can do it. Our procedure is 100% digital. So when you come in, it's a combination of CT scans, facial 3D soft tissue scans, intraoral digital scans that we all stitch together. And then we do the same scans over after surgery. We stitch that together with the pre-op. And so we do 100% total digital design of your teeth. Now, if you look at the slide on the upper left, imagine if you pick Monday as your main day. This procedure is designed for chickens. If you hate going to the dentist, you can't get much better than this procedure. We're going to come in, an upper and lower case typically takes around 2 hours to take out affected teeth if needed, place the implants, and then about 1 hour and 15 minutes or 1.5 hours to do the digital records. Now, the old way that we spent years doing, we would spend about 3 hours to convert those temporary dentures, and you'd be stuck wearing them at our practice for about 8 months, prone to break. At our office, you go home, and then the magic of our lab comes into place. This is the other thing we see other practices trying to pretend that they have what our lab has. So again, what our lab has is we're now up to 2 labs about 1 mile away from our main office in Jacksonville. We have an in-office lab in our Jacksonville office, and we have a design center in Atlanta. We've divvied up the workload into making these custom teeth into 3 groups that constantly work without stopping 24/7. So what happens, your designer will come in around 4 o'clock. We'll spend hours designing your digital teeth exactly how you want. Our second team, the milling team that's going to mill your custom ceramic teeth, if you look at the middle picture, you're going to see 2 restorations. The one on the left is the custom zirconia, and the one on the right is the 3D printed teeth. And so we spend 2 days after the patient approves the temporary teeth, literally virtually nonstop, working to give you master level restorations, no shortcuts, no compromises. And I'll go in detail the amount of work we put into this restoration. So what would happen if you come in on Monday, we want you in our office nationwide between 7:30 and approximately 9 o'clock the next morning. And if you look at the third picture on the upper right, on the right, you'll see the interim custom teeth. So what we've done by the next morning, instead of having a screwed in temporary denture, now we have a precision custom restoration, even though it's still a temporary that we put in. We're checking 3 critical things. We're checking that you like the anatomy. So there's centers now in a rush, we think, to mediocrity, that in trying to go faster, they're skipping what we think is probably the most critical step if you want proper aesthetics. Absolutely. You can never, ever skip the smile preview, because with the absolute best digital records that we've invested millions in, it's not 100% accurate. And by that, when we look at the teeth the next morning as a dentist, I'm looking at the midline to make sure that your centrals are in the exact middle of your teeth. The teeth are perfectly parallel with your eyes. All the curves are perfect like we come out of ortho. I'm wanting the patient to look that when the lips at rest, they like the length of the teeth. We have the patient, what we call the high smile line, smile real big. Are we showing enough teeth, too much teeth, too little teeth? And so there's centers that will do some primitive cosmetic imaging. They'll tell you pick a style. Dirty secret is no cosmetic imaging that you do pre-op has any relationship to the design you do post-op. And so it gives you an approximation. It's a good selling tool. But again, once you do the records, it has no relationship to what you're really going to see when you do a printed try-in. So I can just tell you, if I was doing this on any family member, I wouldn't do this. You need to do the try-in because it's crazy to go and spend 2 days as we do day and night making the final teeth and then find out when we insert the final teeth because you've never seen the design that you maybe thought you liked square teeth with square edges because it looked good on the smile guide, and you see it in your mouth and you go, oh my God, that's not me. Well, now it's too late because now you're stuck with these teeth or the center's going to have to do it over. And I have a time, like, are they really going to do it over after they spent thousands of dollars on making the teeth? And what's funny, a couple of these centers that we see doing that, I just had a patient in today that the center is doing that, and they were quoted $54,000, and they didn't even get a smile preview, but they got it a couple days quicker than a D5. So again, we believe we figured out if we want a master level restoration, no shortcut, hours hand finishing the teeth, multiple layers of stainings, we cannot go any faster than 4 days. And again, we won't go faster. Now, if a patient came in and said, I'm going to go to the other center and I want the teeth done the same day, we have a video that will be out shortly showing you the steps that we would have to shortcut. And you can tell me what steps would you like to take? Would you not like to do the smile preview so you have no clue what you're getting? All the hours that we do literally under a microscope, hand finishing the teeth, making the embrasures look so good that you can floss the teeth? Or would you like maybe just one coat of staining, or would you like almost a day and a half where we spend hand building up the porcelain that makes the restorations look so good? So again, our protocol, if everything goes right to get the 4-day, you come in on Monday, surgery and records. I can tell you right now, we're running about 70% of our patients when they come in Tuesday morning. When we look at the teeth, there's such minor changes. The patient knows what they want. They give us approval. And approximately in our Jacksonville office, Thursday afternoon, you're receiving the final teeth. It can take 1 to 2 days later in our nationwide offices because of FedEx. Now, because we will never make a restoration until the patient loves the interim teeth. If a patient came in, and this happens about 30% of the time, they think they want square teeth and they just totally change their mind about the style and they're confused. We will redesign the teeth that night, bring the patient in Wednesday morning for another try-in, and then on Friday afternoon, you will receive the teeth in our Jacksonville offices in almost all cases. And so it's an incredible time savings to think you can be in horrible shape, have the worst teeth, advanced periodontal disease, and if you're a candidate for thousands of patients, we've been able to offer expedited teeth at an incredible cost. Let's go back. Do we have any questions in chat? So we got some questions. All right. I see. Oh, Beth, look, I'm looking at this done in Philly area.
Why don't you go over where our offices are?
Yes. So we have an incredible office in Philly. He goes all around the country teaching for Neodent, our implant company. Phenomenal office. He is so good that one of the top implant companies in the country, Neodent, he's actually on retainer and goes all around, and he's been doing this for a while, training other dentists in implant dentistry. So if you go in, you're going to get a free consultation, the free CT scan, and then you will be able to, he'll be able to answer any questions you have.
Very good. So I just want to let you know. So what we offer is a free consultation. That free consultation takes care of your x-rays and to speak with the doctor, yes. So that you guys can definitely go over any concerns that you have. We also have Miss Suzanne standing by. She can answer a lot of your questions as well. And she answers for all the offices and schedules in the country. So her phone number is 1-800-609-8613. Again, that's Suzanne, 1-800-609-8613.
She knows this procedure, I think, better than us. She's been doing this for years. And so she's an incredible resource we have. Susan, let's see.
So with bone loss, we have a couple of questions about if you've had too much bone loss.
Okay, so I can tell you basically, give or take, when patients come in for the free consultation, about 95%, give or take 93%, are candidates for the expedited procedure. The main area where we have problems with bone loss is somebody with an upper denture. The upper bone is not as stable as the lower bone. So these kind of patients typically get an upper denture. They're coming back 7, 8, 9 years later, 10 years later. And now no amount of adhesive will hold this denture in. We take the CT scan, and we basically, when we look, if we drill maybe a 32nd of an inch, we're into the frontal sinus or the posterior sinuses. Obviously, implants have to be a certain length for strength if you're going to eat steaks and apples. Traditionally, what we would do, and we still do it occasionally, we would do sinus lift. You lift the sinus up, you put bone in, we wait approximately 4 to 5 months for the bone to heal, and then we come back and do the procedure in an expedited manner.
And then Kelly, he's going to answer your question right now about zygomatics.
Yes. So that's the exciting addition most of our office, including ours in Jacksonville, offers. So we offer zygomatic implants. So there's 2 versions you can do. If you absolutely have no bone from front to back, it's called a quad zygoma. You put 2 implants that start here, 2 implants that start here. They go through this, usually the side of the sinus now is the new procedure, and they insert in your cheekbone. The cheekbone is one of the strongest bones in the body. It's a longer implant. Now, the advantage of that, we believe it's way more predictable than a sinus lift, dramatically stronger. And we've done scores of cases where basically in 7 days or now 4 days, we go right to the permanent teeth. And we're very pleased we have great fees on zygomatic implants. And so even now, if you have no bone, we can almost tell patients have been literally told they couldn't do an upper restoration. We can do many now in 7 days or 4 days, approximately, depending on what office you're in, because of these amazing implants.
Absolutely. It is a fantastic thing. And just to carry on with the consultation, we take care of your x-rays. I do have a question in here asking, she has a previous all-on-4 that's about 10 years old, looking to do some more stuff. We would still need to see you in a consultation because there are hundreds of types of implants.
Yeah. Are you talking about trying to do the restoration over?
That's what I was kind of reading there. I apologize.
I'll tell you what happens, what we see a lot. We get a lot of patients that have had, say, the old original restoration called an acrylic hybrid, and that's denture teeth over a titanium bar, or they went to centers doing PMMA to titanium bars, which is a fancy form of plastic. And it's funny, this restoration really doesn't have FDA approval to use as permanent teeth, and they find out a couple years later there's almost nothing left. So it depends on the implant if it was designed for digital dentistry, but we've helped many people if the implants are good and they were more of a modern implant, we've been able just to do the bridge over. And we have to look at the implants to see if we can do that.
Exactly. And that was for Tina. Celeste, congratulations. We look forward to seeing you. She's having the procedure done.
Thank you. Thank you. So how do I know if I'm a candidate? Well, there's a great section on our website, Am I a Candidate? But I'll give you, where most of our practices are true group practices. In Jacksonville, we do what's best for the practice. We have an incredible cosmetic aspect of our practice, general practice. Then we have a whole surgical wing of our practice. And again, in-house lab and 2 labs across the street. So the perfect candidate, there's multiple candidates. You've been wearing ill-fitting dentures or any kind of denture. The best fitting denture only gives you about 20% of the chewing power of your real teeth. You got an upper denture that covers up about half your taste buds. Maybe it's gagging you, the bone's going away. And so the perfect candidate. Candidate is somebody that's maybe got 40, 50% bone loss or more. And so there's been a paradigm shift if you're especially getting advanced bone loss on the top. When I was in school, when we didn't have implants, we would wait, at least I was trained at University of Florida, we would wait till you had 80% bone loss on the top. Moving mobile teeth will still chew better than the best fitting denture. Now, we don't want to do that if you want fixed implant teeth without doing a lot of bone grafting or now the zygomatic implant. So if you wait till you usually have 80% bone loss and the teeth are loose, when we take the CT scan, we don't have enough bone to place the implant. So my rule of thumb is give or take, is when we start seeing we don't have about this much bone left, because you want to do this affordably and you want to do it, if you can, just using regular implants. When we get to that situation, that's a great time to consider this procedure. Another thing, we see a lot of patients, actually I saw one patient today, and they could have done the crowns over. They had like 6 teeth, I think, on the bottom, definite candidate, perfect candidate for the D5. They had basically about 10 units of crown and bridge, and every crown had decay. We'd have had to do 2 or 3 root canals, and then we had about 20% bone loss. Back in the day, we would have done crowns before the implants. Now it was actually less money to do the D5, and there's two ways to get ceramic teeth. We design the ceramic teeth on the D5 just like we design the teeth for crowns. It's just one restoration we're cementing the teeth, one restoration we're screwing to the implant. So the longevity is in large part determined by the foundation you hook the teeth to. So you get somebody my age and you've already paid 3 times to have the teeth done, the roots are not in good shape. That's a perfect candidate because, you know, we want you to spend, you're investing a good sum of money, even though we have great affordable fees, but we want this to be hopefully your last restoration. And if we can put it on a foundation of implants that directly fuse the bone instead of shaky teeth, we think it's a wiser investment of your funds. So those are, you know, ideal candidates.
So the warranty, this is my favorite part of this whole procedure. Dr. David truly has a 5-year unconditional warranty. You will not find that anywhere else. It is just fantastic. There are companies out there that if you get type 2 diabetes in that 5-year period, null and void. If you smoke, null and void.
And you better not smoke pot.
Right, exactly.
If they catch you, it's gone.
It's
any
just,
autoimmune disease.
Any autoimmune diseases. So this replaces, if unfortunately an implant failed, if your appliance had to have work done it or it needed to be replaced, we replace it. You know, I mean, it is truly an unconditional warranty. It is fantastic that he offers this. It's one of my favorite parts of the whole thing, that you don't have to have a lot of worry in your head with your pocketbook for 5 years.
5 years. Yes. It's truly, and I say that you fall on your face, there's still no fee.
How often should you have a cleaning?
So your first 2 cleanings at 6 months and a year are included in the fee. At a year, most of our patients are doing so well cleaning. Then we go to an 8 to 12 month recall. We have a few patients typically used to wearing dentures that forgot how to brush their teeth. They're used to putting the dentures in a cup. Few of those, they need to come in twice a year. Now the cleanings are painless. Let me show you a model. So what is the difference is, if you look closely, there's access holes, and we cover that up with tooth-colored fillings. It takes us about 5 minutes to unscrew the bridge. The bridge goes in an ultrasonic cleaner like a jeweler uses to clean a watch. We put it in there about 20 minutes. We x-ray the implants to make sure they look good, do a cancer screening, and then the restoration goes right back in. It's about an hour visit. You know, when you brush this, you brush these just like real teeth. You want to use what's called the Bass technique. We recommend 10 strokes. You move over 10 strokes, go around. Now, what this is not exactly like 14 individual teeth that you floss. This is a one-piece bridge. We make the pink porcelain flush to the gum with about a slight 0.5 millimeter gap. And the reason for that is there's normal bacteria in your mouth. And imagine if you never took your shoe off a year. So what happens is you get an oral irrigator or water pick, and at night, after you brush for about 2 minutes, you basically go, I don't know, maybe take 30 seconds and you go around with scope, Listerine, salt water, whatever. We just want you to rinse that out at night. And you want to do that about 7 weeks after the surgery. So what's amazing about this restoration, we're using dentistry's by far strongest ceramic. It's called zirconia. Starts off as a metal oxide. We put it in a sintering oven at 1700 degrees. Metal oxide turns into a ceramic almost with a compressive strength of steel. We've never had a restoration this strong. Okay. Never changes color, never stains. It's an amazing restoration. So that's one of the things if you're considering full arch. There's other final restorations. There's the old acrylic hybrid that it's hard to believe people are still offering. Denture teeth to a bar. Problem is the denture teeth don't chemically bond to the bar. The plastic teeth can't take the biting force when they become permanent. The plastic quickly wears off and everything breaks off the bar. Maintenance nightmare. You know, that was our only restoration for 10 or 15 years. I basically married patients because we were always fixing them. Now there's another restoration. Again, that restoration was invented in 1975 by Dr. Brandemark, who invented implants. It was grandfathered in before you really needed FDA approval like you do for drugs. A new material came out called PMMA. PMMA is polymethyl methacrylate, which is a fancy word for plastic. no PMMA restoration has FDA approval to use in permanent teeth, even though many centers market it as a permanent final restoration. And so according to the Food and Drug Administration, this only qualifies for temporary or long-term use, usually no longer, for most of them, believe it or not, for a year. And the reason for that is instead of doing the individual plastic teeth, it's almost a slip cover. You make a slip cover of plastic teeth that slips over the titanium bar. We see centers that's crazy charging $40,000 to $50,000, and we have patients coming to our office 2 years later, there's nothing left of the teeth. So again, matter if you come to us or any place else, this is like, I can give you one word of advice: never accept a restoration if you're interested in protecting your investment, if it's not zirconia.
So we do have a question. If you have good bottom teeth, but you've been in an upper denture, can you get these?
Yes. These are custom teeth. So when we take our digital records, if we were making a denture, you wouldn't have to take out your lower teeth. So we have a precision bite of how we're going to make the upper teeth when we digitally design fit to your lower teeth. There's actually a couple things. We do this so many times. This is your choice you have. If we're going for maximum aesthetics, say like your bottom teeth are a little darker than you want. Now, if you want to really go light on the upper, there's two ways you can do this. You can come in and do the upper with any shade you want. And then, well, I take that back. You can come back 2 to 3 shades lighter, and we can bleach the bottom teeth to blend, because when you smile, you hardly show the bottom teeth. So unless somebody goes like this, that allows a lot of people to go lighter on the top with a minimal investment in the bleaching. Now, if you're very picky and you want to go really light, then the other option is these teeth are, sound. And what we do a lot is we'll do the upper D5 and we just do 6 veneers. So a veneer is basically you take off about the thickness of a debit card, and then we can actually bond a porcelain, almost like a fake fingernail, to the tooth that exactly matches, and you can go ultra white top and bottom and still save your lower teeth. What do we got?
So we got Russell. He's having trouble with the confidence in the local provider there in Atlanta, Dr. Schiffer. It doesn't mention a lot of things on the web about her. Dr. Schiffer is amazing.
She is amazing. I don't know if you've been to her office. It's like about a 6,000 square foot, totally state-of-the-art office. She's got an amazing way she places the implant. It's a technology that actually almost uses like live radar when she's placing the implants. We don't have that in our Jacksonville office, but when she's placing the implants, she's actually on a computer screen seeing the exact way the drill's going. And it's just an amazing precision she brings. She's got 2 other really distinguished surgeons, and she's just done scores and scores of arches to just an incredible level. So I would just, urge you to go in for a consultation. She's got scores of cases she's taken photos of, and, give her a chance and see what you think. So, I'm just totally impressed with Dr. Schiffer.
So there's one thing I want to mention here. We've had a couple of questions about the exclusions with the warranty. That was speaking of other offices. The D5 collaborated offices has a 5-year unlimited warranty. There are no exclusions.
Nothing.
I want to make that very, very clear. There are no exclusions with the 5-year warranty.
Yes.
Night guards. Well, let me tell you, Mitch, you actually get a night guard when you get your permanent teeth. Yes, you get 2. You get a soft one while you're healing, and then you get a hard night guard once all the healing has completed.
Now, while we do that, when you come in to get your final zirconia teeth, we have a soft night guard because the implants aren't fully integrated. So we want to protect, but not fully protect if you're grinding. And so when we hit the right before the 90-day mark, when the implants are fully healed, we bring you in for a final check where we're checking the implants. We digitally scan the teeth, and then we do a very sophisticated TMJ stent that's basically hard on the outside, soft on the inside. And it's designed like with the ramps on the canine that when you go, it's called canine guidance. This is like one of the best night guards you can design to protect teeth if you grind. And again, why you would want the night guard, I'm a heavy bruxer, and I've restored so many teeth with crowns or the D5. You get in REM sleep, which is the deepest part of sleep. You don't know you're doing it. And all night long, you're doing this. It destroys teeth. It will ruin implants. It'll ruin any restoration we do if you're a heavy grinder. So you get 2 bite guards, and it's included in the fee.
Had a couple questions about the sedation.
Okay, yes. So we offer in all our offices. So there's 2 kinds. What we do in the majority of the time is conscious sedation. So what we like to do is a twilight sedation. And the reason for that is it leaves the patient in a really good mood when the surgery's done. And because when we do the digital records, they have to be done exact. And we have to have a patient that can cooperate a little bit. The problem we have is when we do IV, 2 things. A lot of patients who are the most nice people, normally when they come out of IV, are very belligerent for maybe sometimes an hour, hour and a half, or they have to go in recovery room for an hour to 2 hours before they are alert enough. So we get true dental phobics, and we have nurse anesthetists in our Chicago office and anesthesiologists. So we do offer that, but we prefer to do the conscious sedation. We've done thousands of arches over the years. Patients are totally comfortable. You're floating in la la land. And then that's how we prefer it.
Yes. And again, we have Suzanne on the phones for all of our offices. Her phone number is 1-800-609-8613. She can answer many of if you have insurance questions, she can set you up for your consultations. And that is with any of the D5 offices.
Now, why we do so many, when you look at our fee, we also file the insurance for you. And in these times of high inflation, with our fee, basically what it is now, most insurances will give you anywhere from $2,000 to $4,000, $5,000. And so just by getting to the point of doing the extractions if needed, we can get you full coverage with your insurance. And so this is the big difference. If you look at a lot of centers that are traditionally charging $50,000, $60,000, if you look on our site, I didn't realize the difference, but at our fee, if you look at the 60-month payment, it's centers charging around $50,000 for 60 months. You're saving at our centers around $400 a month. And we started laughing. You could almost buy a car with that. I mean, it's like a crazy savings. And when you think about this, you go to an old-fashioned teeth in the day center that hasn't invested in digital technology. They don't have their own lab, or they have a small lab. They put you in a temporary denture that is all kinds of guesswork is made. You wear that 7 or 8 months. You come back from multiple visits because they're using a lab that's commercial. A person will pick up the final impression. It goes on a shelf for 3 or 4 days. There's 10 dentists in front of them. You come back in 2 weeks for another visit. It's not done digitally, so you got all these wax rims that a lot of practices use instead of digital technology. The next thing you know, maybe if you're lucky, 2 months later, you have the same restoration that we've delivered in 4, 5, 6, 7 days. And then they're charging you in a lot of cases thousands of dollars more, which doesn't even make sense. And so that's why we do so many of these restorations.
To answer your conscious sedation question, Beth, it is triazolam or Halcyon.
It depends, or Versed.
Or Versed.
Yes.
Yes.
Excuse me.
So can you have the top done at one time and do the bottom one later?
So I'll give you my advice. If the bottom teeth are really good, that's all you should ever do is the top. We understand finances. So we have a lot of people, the bottom teeth are almost as bad as the top. If the bottom teeth are in the correct plane, but say you have 80% bone loss and you want to hang on to it for a year, we can do the top and it'll actually come out good, because to chew, we have to match the top teeth to the bottom. Now, if a patient is also saying, I'm more interested in function. You get people my age, a guy saying, you know what, I got 6 teeth. All I care about is I want to eat a good steak and corn on the cob. If the aesthetics are a little bit off, it's not going to bother me. No problem. If I get a patient in, want to do the top because that's the worst, but the bottom, the teeth have shifted, they've moved, they've drifted up. We can have no problem giving you perfect occlusion, but if you want maximum aesthetics, the teeth should be perfectly parallel. And so what you'll see is the teeth are up and down. And so you do the upper, that I can make the front parallel. It's the back, if you're picky, you'll notice it's up and down. And so when you come back, say a year later, then we do the lower. And go on our website. Dr. Ziegler, who is the founder, owner of Zirconzon in Italy, was on about a 2-year project to design that bridge. And so that bridge has a 7-year warranty. Yeah. Again, the purpose of this is, we think the hardest part, I've said this a million times, the hardest part, if you're suffering from missing teeth, you're embarrassed in business or social situation, is just to come in for the consultation. So, we have offices in Chicago and Atlanta and Philadelphia and Orlando and Jacksonville, soon to be Dallas. And just call Suzanne and get an appointment. You have nothing to lose.
That's right.
Get the CT scan, see if you're a candidate, but you have like 95% chance you are. If you've got an upper denture with the zygomatic implants, even if you literally have no bone, there's probably a 98% chance we can still do the procedure. And so, that, again, it's 1-800-609-8613. And let me see, any more questions?
Nope,
No, I
that
think
was
that's
pretty
it.
much it.
Yeah.
This
So,
was great.
This was great. So again, I appreciate very much you taking the time out of your time or the night to talk to us. If you come to Jacksonville, you'll personally see me and you'll see Michelle. You can look at her teeth up close, and we would love to see you. Thank you and good night.